This is the new diabetes chart, which has been constructed by specialist diabetes nurses, a consultant endocrinologist and pharmacy, and trialled over several months on St. Teresa's ward. The first thing we need to highlight is that it's only safe to use the orange tip syringes with insulin. Failure to do that can result in a 10-fold overdose error, which we don't want. Try and make it clear as to why this patient requires monitoring. For example, this patient is on steroids but has no prior history of diabetes. There are some precautions that are listed on the front of the chart for type 1 diabetes, perhaps people with insulin pumps, and what do you do if you have DKA. We also empower doctors and nurses to manage hypoglycemia in a standard way, and down the bottom a very popular section which is a list of all the commonly used brands of insulin, whether they are rapid, short, intermediate or long acting, and also some of the pre-mixed analog insulins that contain two types of insulin in the one syringe.
So this is the prescribing part of the chart, and if you see here, the NovaRapid is prescribed in the insulin prescription chart. We do not have to write the word units because it's after each dose. If we look at the prescription chart, the time with the blood sugar, then the dose of insulin, and then
on the right hand side we have the supplementary doses of insulin which are given in addition to the normal dose, and that is dictated by the algorithm on page 3, which you will see in a minute. You'll notice that there are two different types of insulin used in this patient on the first day, NovaRapid and Lantus, and you'll notice that they get their regular doses and their supplementary doses, which the nurse has signed for. So down the bottom here on page 3 we have the supplementary insulin which I was referring to in the regimen earlier. The main difference in terms of the improvement for this edition of the diabetic chart is that it applies to all patients requiring insulin and makes no distinction as to whether they have been on insulin before. If the standard regimen does not work, then you have the option of scheduling a different regimen here, which would normally be done in consultation with the diabetes service. At the top of the chart, you can see that this patient has had fairly frequent doses of NovaRapid. This is a perioperative regimen where they are checked more frequently and given NovaRapid accordingly based on the next slide. Here we have the last page of the 4-page guide, which relates only to perioperative stroke fasting management. So this is short-term strategy. You make a distinction between three types of patients. One are diet-controlled type 2. The second is a type 2 well-controlled on oral hypoglycemics. And type 2 are essentially the more difficult to manage patients on insulin or just problematic. And here we choose the strategy based on the type of insulin regime they're on and make recommendations about what they have the day before the procedure and the day of the procedure. In this case, we're going with the second strategy here. And we also provide an infusion of potassium, saline and glucose perioperatively as well. In this case the patient has no renal failure, so we're selecting the first of the two options. Down below you have your perioperative subcut scale, and again there is an alternative scale on the right hand side for those more difficult to manage patients, which diabetes again will be contacted about. Note that all the monitoring and recording of blood glucose goes on the two inside sheets we discussed previously.